People come to the hospital because there is something wrong with them. People don't come to the hospital because they feel or think that something will happen to them.
You're a natural born public speaker, and that's a fact.
Do you actually feel guilty or were you just told to feel guilty? Focus on actually what we can do.
Point it out and show it to me.
You have the freedom to do what you want to and be what you want to in America.
What are we going to do with that? What oppress me?
Just saying.
So the CRT stuff, BS.
How are you guys all doing? I'm Ty Smith, Modern Renaissance Man, and welcome to this segment right here where I'm just going to be doing some basic talking. I guess I'm trying to get to a point where I'm going to be announcing which segment of my variety channel I'll be doing. So right now, you guys should be able to figure out. I don't think it should take that much for people to try to, decipher what am I doing, because it should all be in the title. Anyway, oh man, Mr. Governor Pritzker of Illinois decided to mandate masks K through 12. For what reason, I do not know. For any of you they are going to try to contest this, arguably, go right ahead. But, oh boy, it's just all continuing test, isn't it? All continuing tests. So let me ask you something to the ones that are vaccinated. I'm not saying it to sound condescending or anything like that, but some of you are going to take it that way. For all you that are vaccinated, that sat there and you said so much stuff to me over the course of this summer, over the course when vaccination was still being pushed down. And I told you guys, even when Trump did it way back then, I told you, I don't care. I like Trump, but I'm not, just because Trump said to do it, I'm not doing it. I still have not done it. You sat there, and even just the other day, you guys were all just, that's a shame. You're not vaccinated. You can put your family at risk. You can put your sons and your wife at risk. You can put your grandma, your grandfather, your cousins, you can put them at risk. If you do this. If I do what? If you continue on with this rhetoric of not getting vaccinated. What about you right now? Ye who are vaccinated. What's the difference between you and I? You can spread it to your grandma, your grandfather, your children, your husband, your wife, your co-workers. You can spread it to them just like I can. Huh? So what good did it do? Oh, well, it can be less severe. Where's the data on that? Anybody that's saying if I get COVID again with the vaccine, my symptoms is going to be less than what yours would. Where's the data on that? Where's your proof on that? It's the same exact nonsense they say about the flu. If you get the flu vaccination, yeah, you may still get the flu, but your symptoms are going to be less severe than ones that don't get the flu. Where's the data at on that? Like, did they actually study people like, well, I'd never gotten it anyway, but are they actually willing to study people like me? Let's see what's going on with Ty. It's kind of strange that this guy doesn't have no vaccinations or anything like that whatsoever, but for some reason, he has not gotten COVID-19. Why not? Well, you can be a super spreader, but Barack Obama with his 700 people can't be a super spreader. Huh? You really have to think about what's being done here. But right now, I can feel it. A lot of you are just upset because of what I'm talking about right now. You just upset because it goes against what you agree with. And you instantly become upset. You instantly just want to fire back and battle and just say all kind of nonsense stuff to me. Call me a super spreader. Okay, but you wasn't calling me a super spreader when the vaccine wasn't even talked about yet, when coronavirus was just rampaging the United States, COVID-19 rampaging the United States. You wasn't calling me a super spreader then, weren't you? When there was no talk of there being a vaccine. What you were calling people like me that work in the healthcare field were heroes. We're heroes. We're putting our lives on the line every day by going into the most dangerous place you can go, and it's full of bacteria and germs called a hospital. We were heroes then. Doctors, PAs, therapists, therapist assistants, physician's assistants, LPNs, CNAs, even people that work just in housekeeping, who, by the way, are some of the most important people that can work in healthcare at all, because they are the ones that can definitely keep things clean, sterile. But my point is, I and other healthcare workers, we're considered heroes before folks are talking about a vaccination. Once the vaccination came out, all of a sudden we're considered to be super spreaders now. But we weren't super spreaders whenever we were helping your family that may have come in there sick. And I'm not just talking about from COVID-19. I'm talking about from anything. So we're not heroes unless there's a pandemic going on. Do you understand that although there's going to be some that actually disagree with this, because certain folks got a certain type of mindset, There are certain things that we follow. There are certain things that I have done in my whole medical profession. Now, when I say I've worked in the hospital for 20 some years, I'm not talking about in one career. I did transporting dead bodies, transporting people that might be needing to come from the ER up to a certain floor. I did transport. If you know what that is in the hospital, you get it. Transport. I done EKGs for a while. I've done telemetry. I was a unit secretary. I was a physical therapist tech. I've done all these different things in the hospital over the course of 20 years. Guess what? All of my years of working in the hospital, I have not contacted anything. I have not contacted anything. I have not gotten a flu. I have not gotten an accidental stick. I have not gotten hepatitis. I have not gotten tuberculosis. I have not gotten 7+ droplet diseases that you can get through saliva. Am I lucky? No. Is it because of my age? No. Is it because of me being in great health? No. It's because whenever I get ready to go into a room that may have droplet precautions, airborne precautions, contact isolation, I put on the proper PPE while entering that room. Folks, I'm trying to get y'all to think about something. There are like 7+ illnesses right now, besides COVID and besides the variant, that you can get right now. Tuberculosis. How do you know your next door neighbor don't have it? How do you know the people you shaking hands with at church and that you hugging and all that? How do you know they don't have tuberculosis? How do you know they don't have MRSA of the nares or MRSA of the glands, MRSA of the salivary glands? How do you know they don't have MRSA? Any of that? How do you know they don't have mono? How do you know this person didn't just like have like an eyelash fall on their tongue and they did like this and without even wiping their hands off, they came and shook your hand and you got it. You went and ate somewhere. I mean, how do you know? Most people have a hard time with what I'm talking about because it goes against a lot of things you taught. People, this is what I don't understand about some folks. Why is it so hard for you to actually accept hope? Why is it so hard for you to accept real science, hypotheses? These things are meant to be doing these type of studies for a reason. I'm sorry, I got thrown off because you hear the buzzing back in the background. But my point is, why is it if somebody come and say things other than what you've been told? So it's amazing to me. Y'all do know that nobody is an expert with COVID-19, right? You do know that we've never dealt with COVID-19. But yet because somebody come along and tell y'all what they recommend that you do, you go and do it without questioning it. I told you before, you can get mad at me all you want. If we come towards a body of water and you guys all say we all should get in there and swim, not me. I'm going to wait for you guys to get in there and see if y'all get bit by something, get eaten by something. I'm going to wait some days. I'm going to wait a long time to see, although you may have come out the water fine, I'm going to wait some days to see if you end up developing some type of fungus, some type of infection, any of that. I'm not getting the water. I'm not drinking that water. So with this right here, all of a sudden people are experts with COVID-19, even though we never had this happen. All of a sudden people are experts, but no. No one can sit there and say I'm an expert at COVID-19. Well, then you're saying not to do this, so does it make you an expert? No, but what I am saying, there's something called universal precautions when it comes to airborne illnesses, when it comes to contact illnesses, when it comes to things that can be transferred through saliva, through bodily fluids, through hand touching, through the skin. Yes, you can get MRSA contact too. You can get a lot of things. But do you go through your everyday life wondering, anybody you pass in the mall, if there even a such thing as that even more, anybody you pass in Schnucks, any bag you touch at Schnucks, any bottle that you grab, how do you know somebody then and they grab that bottle and they looked at it, I don't want this, they put it back right there, and then here you go shopping your day, you grab that same bottle, you look at it, yeah, I'm gonna take this. No matter what, even if you don't take it, you've touched it. And let's just say, again, anything can happen. You got a piece of hair, something in your mouth, and you touch it, take it out with your fingertips. You just put MRSA in your mouth. You just put mono in your mouth or something. You just put tuberculosis. I mean, it could be any number of things. You have become hypochondriacal. Yes, hypochondriacal. That means a hypochondriac. Hypochondriacal whenever you sit there and you think that something is wrong with you. So that's what they have created. They have created a whole society of hypochondriacs. People that are sitting there worrying that something is going to happen to them. People that are sitting there worrying and betting that they're going to get something. I don't live my life like that. So the ones that want to come at me and call me an idiot, call me stupid, call me dumb. Oh, well, 600 million people died or 600,000 people died because 600 some thousand people died because they died with COVID. Do your research to see who died with COVID versus who died from COVID. It's a big difference. I work in the hospitals, ladies and gentlemen. We are there. I don't care what these so-called mainstream media reports are telling you. Just like right now, you being told, oh, there's a huge influx of hospitalizations. You need to clarify what hospitalizations mean. There's a difference between somebody going to the hospital and somebody being admitted to the hospital. I do this stuff. I've been doing this stuff for years. We in the hospitals are sitting there laughing at some of the stuff they're saying. Oh man, they had over 1,600 people went to the hospital with COVID-like symptoms, but that does not mean they have COVID. 600 people, there's been a huge spike in hospitalizations. Yeah, but there could be car accidents, a shooting, a hit and run, domestic battery, accidental electrical shock, hurt on the job. It can be a number of things why hospitalizations have spiked, including those that may have this variant. But why is it there's no little ticker on the side anymore? Maybe I'm missing. I don't know. I haven't seen so many news stations or anything like that. But why isn't there a whole lot of little tickers off to the side showing you deaths from the variant? Huh? Why? Where did all that go? Remember, it's almost like a darn counter every day showing you how many people died from COVID. Why isn't that there anymore? So just because there's a spike in hospitalizations based off this variant does not mean there's a spike in deaths. Do your research, do your research. And for the ones that keep on getting upset, it's almost like y'all wishing bad health on me. You're wishing I get something. I told you, as of February of 2020, 50% of my patient caseload have consisted of patients that were COVID positive. I go in there, I put on the mask, gown, gloves. It's not my first run in with coronavirus. Yes, COVID-19 may be its own thing now, but coronavirus itself, I've treated patients that had coronavirus. How would y'all feel if your uncle got coronavirus? They're starting to recover from it. Do you have people like therapists that go in there and treat them? Like some of the things I was doing with therapy. We go in there, we read their report. We see that they might have coronavirus and they might end up developing some pneumonia or anything like that. We see what lobe it is. So now as therapists, we can do some things on their bodies to actually kind of help break up some of that mucus that's in their chest. And then we teach them how to cough and get it out and hack it and spit it out. We do things called like tapotment. We lean them certain directions depending on what lobe that this fluid is in. And we can do tapotment on them to break it up. We can put them on certain machines that will vibrate them to actually break up that mucus that's sitting there on the bronchioles and help them cough it up and hack this stuff out. I did this type of stuff like this for years, and especially in isolation. Working on the isolation floor where you actually are purposely going in there where somebody is highly contagious with some type of airborne illness, is a bloodborne illness, no matter what it is. You guys know that I've had people that I work with that will refuse to go in and treat people with COVID. They will refuse to go in there and treat people with HIV. Refuse to treat people in there that might have tuberculosis. You know what I mean? They refuse it because they freak out. They feel like they're going to get it. But somebody like me, I'm like, hey, look, we just follow the universal precautions, right? I put this on. I do that. I do the things like I'm supposed to do. I'm not going to be worried about getting it. What about doctors, nurses, PAs, OPA, whatever you may be, who actually went in and seen some family members of yours that have highly contagious diseases that they may have, whether it's bloodborne, airborne, whatever. What do you say to them? Do we seem like we scared? So now, before COVID came, and I was treating people with these different illnesses that they have that is contagious, you say things like, oh, well, that's cool that he's going in there. He's doing the proper PPE. He's doing what he need to do while he's going around somebody with it. You sit there and say that's good in because there's people that won't do it. But now with COVID-19, because the whole world seems to be freaked out and scared, not the whole world. Let me just backtrack that. The nation, a lot of people in this nation seem to be freaked out and scared of it. And if you're not scared of it, I'm not talking to you. If you have the vaccine and you're not scared of it, I'm not talking to you. I'm talking to the ones who are hypochondriac acting over this. You are freaking out over something that you have a high chance of surviving. And I know some of you guys have come with these stories. Oh, my mom is suffering right now. She's in the hospital right now with COVID. She's in this. She was perfectly healthy. You don't know that. You don't know. Well, I mean, I say that some of you may know that, but there's a good chance of, I've been in this for so long. That's why I know it's going to hurt a lot of y'all feelings, but I can't hold back no more on a lot of stuff that I deal with on a daily basis with patients. There's a good 95% chance that you don't know that your parents have underlying things. There's things that in medicine we cannot disclose to you because of HIPAA, that when I read your mother or your father's chart, that you may feel and think that I have people right now I don't understand what's going on with my mom. I mean, she's perfectly healthy, not knowing that on your mom's list, no, your mom is not. But I'm not going to tell you that. Your mom, if your mother or your father make you POA over their medical records and you want to get their medical records, oh yeah, you'll be in for a shock. And a lot of people are. My mom and dad was perfectly healthy. They had nothing wrong with them. But yeah, we do that blood work. Or if I go in there and treat your family member and I sit there and I pull out their chart and I see all these underlying comorbidities that they have, yeah, I'm not going to come out and say, well, yeah, your mom does have COVID, but she also has emphysema. She has Mets to the lung. She has this. She has that. I can't do that. That's violating HIPAA. Unless she released you to be able to see those as a POA or something like that. So that's what I'm saying. I know a lot of you came with those stories talking about my mom was healthy, my dad was healthy, here and they are in there fighting for their lives. Well, I can guarantee you there's a good chance that I think on the upwards from like a lot of the people that I've been dealing with, a lot of the doctors that I've been talking with across this country, a lot of people definitely have comorbidities. They have 8, I think somewhere, and don't quote me on this, I think anywhere from people that actually have a high rate of passing away from this is definitely elderly, but those elderly also have like 7 or 8 things they got going on, along with taking anywhere from 7 to 15 different medications. And the ones, let's just say from 60 to 70, they may have 5 to 7 underlying comorbidities going on, along with taking 5 to 10 different type of medications that can affect them in all kind of different ways. Go below that, anywhere from 40 to 50 years old, anywhere from 3 to 7 different medications that they have, and they might have anywhere from 3 to 7 comorbidities going on that got affected by COVID, and then it pretty much wiped them out. There's a lot of factors that come in there. So when people throw things at me, that's why, I know it upset y'all, some of y'all that I've written back. I said, I'm sorry about your loss and anything like that, but your parent most likely did not die from COVID. They died with COVID, along with other comorbidities that they may have had. Oh, she was perfectly healthy. No, they were not. Anybody that had a parent that died, a cousin that died, or anything like that of the sort, I would love for you to show me any type of records that you may be able to obtain from them with their medical records and show me that they were just a perfectly healthy person. Nothing going on with their nothing. So when you have people like me to come along and say, so what good did it do? What good did the vaccination do? I don't have it. I got people that I work with, tons of people that I work with that are not vaccinated. None of us got COVID. We all kind of seen the same patients. We all actually some of us work within the same vicinity with each other. I'm talking like we're right in front of each other's face. And none of us have gotten it. There's people I work with in other facilities and down in the St. Louis region. Same exact thing. When we go into patients' rooms that may have came from the hospital and they're quarantined for 14 days, we put on the proper PPE. When we're down there among each other, we take our mask off and we're kind of talking to each other, and none of us have gotten it. But yet you want to say that we may be asymptomatic and spreading it. So to the ones that are vaccinated who say, yay, I'm vaccinated, they say I can go amongst my family, yada, yada, peanut butter. What do you say to yourself? Do you feel guilty right now because there's a good chance that you affected your child, that you have infected your mother, your father, any of the sort? But yet you still want to get mad at somebody like me for choosing not to get vaccinated. I know it's upsetting some of you guys. I know it is. So here's the thing. It's been too much flip-flopping. The masks work. The masks don't. I'm not talking about the ones we use in the hospital. Like if we got a KN95 mask, some even higher, greater than that, I'm not talking about those. But the typical surgical paper mask that you wear, you're pulling your shirt up over your face. No, I'm sorry. Your shirt under a microscope looks like this. The gator things look like this. The minute you stretch them out, little bitty holes open up like this. Y'all see that? See that? It can look like this to the naked eye. But once you pull that gator neck thing under, or even just put a mask on, depending on how big your face is, it's a possibility that, no, not a possibility. When you look under the microscope, it opens up like this. Little holes open up. So you need to know what size the virus is to be able to enter through those small microscope, because it's still the mask, certain mask, the basic mask you get on the airplane. Those things, read the back of them. They say it tell you it cannot protect you. Pretty much is what it's telling you. Your shirt, it won't protect you. I know y'all saying your shirt. Why you put your shirt up? Because there's no different than you getting a piece of shirt like this sleeve right. People cut off sleeves, put it across the head, and pull it up. That's not protecting you from the virus at all. So this video was brought to you by this video was made for those certain people that I know some of you just like to argue for argument's sake. But I'm sorry if any of you lost a family member, any of that. My condolences. But that's not going to make me feel sorry or make me feel shamed or make me feel whatever for doing what I choose to do with what I want to do, period. I've worked in the hospital setting, I told you, over these different jobs for 20 some odd years. I don't have a hepatitis B shot. I didn't get a hepatitis A shot. I didn't get nothing. The only thing I do, we have to do the TB testing, but there's no vaccination, or I wouldn't be getting that either. I don't get the flu shot. I'm not getting this COVID shot. If the hospitals that I go and work in, if they require me and they try to force me to get the vaccination, I will no longer be working in those hospitals, period. I'm not doing that. And I hope some of my fellow therapists, doctors, PAs, OPAs, whatever may have you, nurses, I hope they would want to do the same thing, because again, think about this. Over a year ago, what were we doing differently? We washing our hands. We all talk about how, I make sure my hands are washed, yada, yada, peanut butter before stepping into this hospital. While in the hospital, with COVID going on, whether the patient has COVID or not, every time we left that room, we over there at that wash station washing our hands, scrubbing between our nails, drying them off, no matter what. And here we are. None of my coworkers in the hospital setting had COVID. None of them did. We've had now a few people that I actually worked around that they tested positive for COVID, but didn't really have no symptoms. I think, no, let me not say that. I had some coworkers I know of that lost their taste and smell, but that's about it. And most of the ones that I do know that worked within the hospital settings, you guys all know that y'all just had some of the mild symptoms. Just all of y'all were taste and smell. Some of y'all had a mild headache, and y'all were enjoying those 10 days that y'all got off with pay. Y'all know y'all were, so don't even front. But anyway, as of my coworkers currently in those hospital settings or in the different facilities that I travel to, nobody had it severe. No coworkers I know died of it. None of my coworkers I know had relatives that died. There are people that did die, but not from COVID. They died with COVID along with other comorbidities. Before I close this out, let me let you understand something. Every day, your body is doing all sorts of miracles within your system. It's getting rid of dead skin cells, making sure your organs are in check, giving you signals to let you know that it's thirsty, trying to process your food, metabolize things, cause you to go to the bathroom to pee, to do the number 2, trying to take care of whatever ailments you may have going on, along with you may have high blood pressure, diabetes, I don't know, cystic fibrosis, emphysema, I don't know. Along with your body trying to take care of all of those inflamed things that's going on within your system, along with your body trying to process certain type of things you put in your body that may be considered toxic. Certain medications you take is toxic to your body, toxic to the liver, toxic to the kidneys, toxic to the spleen. Your body is trying to take care of all these multiple things while on top of dealing with COVID. So yes, it can definitely wipe the body out. It can definitely completely wipe you out. Every single day, people come to the hospital with all sorts of things. Why do people come to the hospital? People come to the hospital because there is something wrong with them. People don't come to the hospital because they feel or think that something will happen to them. If they do come to the hospital saying, hey, I feel that something is going to happen to me or something will happen to me, we're going to send you home. Or we're going to say, okay, well, since you feel something is going to happen or something may happen, let us do a few tests on you real quick. We're going to rack up some money by charging your insurance for things that's nothing wrong with you. And when we get done doing all that, the doctor may prescribe you some antidepressants or something to deal with the anxiety that you have because you're hypochondriac. So you're taking medication to calm your nerves because you're nervous about something that you may or may not get. Yeah, think about that. Folks, let me know what y'all think. I'm out of here. I know I missed a lot of great details I could have did. All the good thoughts come when you get done running your mouth. Y'all ever have that? Let me know what y'all think. Don't forget to subscribe to the channel. Make sure you hit the bell notification if you want to, but make sure you get an idea what this channel is about first. I am Ty Smith, Modern Renaissance Man, hoping and praying that every last one of you have food, shelter, and clothing. And most of all, I hope and pray every last one of you guys are in great health. God bless you through Jesus. What is going on, folks? Appreciate you guys watching. Do me a favor. If you're trying to get to the next reaction video that I did after this video, it's right here. But if you're trying to get to my own personal stuff where I do a lot of comedy things that make you laugh, can help brighten your day, then you click right here, all right? And if you want to subscribe to this channel, you forgot to, get to know who I am first, all right? Then you're going to click right here to lead you into this subscription. Make sure you hit the bell notifications to get notified anytime I post a video, all right? Peace.